Dr. Hobbs, would you explain why ET develops and what causes it, going into a little bit further of the key mutations and kind of when it happens in life, who it impacts, if there's certain age groups, genders, or populations?
Great. So ET is usually diagnosed when people are in their 60s, although about 20% of patients are going to be diagnosed younger than 40. ET is slightly more common in women than in men, but it can certainly impact both genders. Now, why does ET happen? That is a great question that we really don't have the answer to, but we know what mutations cause it. We just don't know why folks get those mutations. So a genetic mutation in the case of ET occurs in blood-forming stem cells and gives rise to too many platelets being made. A genetic mutation is basically a mistake inside of the DNA of these blood-forming stem cells that makes it so that these cells don't respond normally to the cues that they're getting from the body to say you have too many platelets, and so these stem cells just make too many platelets. There are 3 key mutations that happen in patients with ET, and usually patients have one of these 3 key mutations, although there's a small fraction of patients, less than 10%, that are what are called triple negative, meaning they don't have any of these mutations. The most common mutation, happening in about 2/3 of patients, is the JAK2 mutation, followed by the calreticulin or CALR mutation that happens in about 25% of patients. And then the least common mutation is a mutation called MPL. And so ET basically occurs as a result of these mutations that lead to the blood-forming stem cells to make too many platelets. And that's usually how we end up diagnosing patients. They have too many platelets, and they also have a mutation that leads them to make too many of these cells.